Well, are you on certain medications that are causing your blood pressure to be high? Or are you experiencing high blood pressure and you don't know that this can be caused by certain medications? Well, let's dive into it. The American College of Cardiology and American Heart Association has listed a group of medication that can cause high blood pressure, either short term or long term. Let's dive into it. The first group of medications are amphetamines. Amphetamines. In fact, some people take amphetamines medically prescribed, or some people are just using amphetamine on the street. These medications can cause high blood pressure. So if you're on certain medication, especially if you have ADHD, there are certain medications that you take, and some of them has amphetamine in it, and they can raise your blood pressure. So if you're experiencing that, talk to your doctor if there is any alternative. The second group of medication are certain antidepressants. Certain antidepressant. In fact, many people these days have depression and they're on certain medication. Before you started the medication, you had normal blood pressure. For some reason, your blood pressure is not going up. You don't know why. Well, this group of medications can cause high blood pressure. They are the SNRI. You can Google them and you find the names, or the TCAs. TCAs. If you Google the antidepressant under the category TCAs or under the category SNRI, you'll find a list of them. They can actually cause your blood pressure to be high. And there are alternatives that you can take if you are any of those medications and for depression, and yet you're having high blood pressure. The ones that did not really cause high blood pressure will be SSRI. So you can talk to your doctor and see if that will be a good fit for you. The next category of medications that can cause high blood pressure are the decongestants. You know, when you have a cold and you go to the store and you get some of the decongestants that contains phenylephrine or pseudoephedrine, Sudafed, that most people take, they can cause high blood pressure. In fact, if you have high blood pressure already and you are taking these medications, warning, your blood pressure is going to shoot up. So find out that you can use them transiently if you have to decongest yourself, or you can use other alternatives if you have high blood pressure. You must be very careful taking these nasal decongestants. Now, if you have to be on them transiently, it's fine. But if you have to then be on them for a long time, watch out. Your blood pressure is going to shoot up to the roof. The next group of medications are NSAIDs, very, very popular. Ibuprofen, naproxen, Advil, diclofenac. All this medication can cause narrowing of your blood vessels, therefore causing fluid retention, and that will shoot your blood pressure high. You've been taking NSAIDs chronically, you wonder why your blood pressure is very high. That is because it is causing narrowing of the vessel, causing a lot of fluid retention, and therefore your blood pressure is shooting up high. So alternatively, if you need to take pain medication, do not take NSAIDs for a long time. You can take Tylenol or acetaminophen or paracetamol, as it's called in other countries. Those will be other alternatives. But of course, if you have a liver disease, you don't want to take those either. But if you don't have a liver disease, then those are good. You can take them and it will not affect your blood pressure. The next group of medications, birth control pills. This is very particularly in women in the childbearing age who want to protect themselves from getting pregnant, or that they have not planned. If you take any of those birth control pills, especially the ones that contains estradiol, those will cause your blood pressure to go high. Instead, you can talk to your doctor and see if you can take medication that has low dose of progestin in it, low dose progestin only birth control pill. You can discuss with the doctor and see if that is right for you. That will not cause your blood pressure to shoot over the roof. All right, that's very important because you see a lot of young women all of a sudden they are on a birth control pill and their blood pressure is very high, and that's because it has estradiol in it. And the alternative is to taking ones that are low in progestin, and that will help you so that it doesn't cause your blood pressure to go over the roof. The other form group of medication also that can cause your blood pressure to go high is systemic steroids, prednisone, methylprednisone, decadron, all those medications. If you're on it for a long time, they'll cause fluid retention, and therefore they can cause your blood pressure to be high. If you have to be on it transiently for certain conditions, it's okay. But if you are on it and you see your blood pressure going up, it's because of the steroids causing fluid retention. But if you're on it for a long term, if you have to be on it for a long term, then alternatively, you can discuss with your doctor or start taking blood pressure medication or do some of the things that I showed you before, the natural ways to lower your blood pressure whilst you are taking prednisone or steroids. And the other one is some immune suppressant like cyclosporin. Most people who have had transplants before or they have transplants, they are on immunosuppressant because they have to be on that. But cyclosporin is one of the ones that can cause actually high blood pressure. There are other ones that will not cause high blood pressure. And so discuss with your transplant team and see if you are really struggling with high blood pressure because you are on these medications, and then talk with them and see if they want to transfer you or to give you alternative medication that will not cause your blood pressure to be high. Now, the other one is recreational drugs. A lot of people that, not a lot of people, but these days you see most people, or not most people, you see people on recreational drugs like cocaine, or excessive alcohol use, or methamphetamine. I talked about methamphetamine earlier on. These medications will trigger an increase in blood pressure. So if you're on this medication, they're dangerous, they can kill you, and especially they can cause your blood pressure to really go off the roof, and you have to be very careful taking these medications. Now, what about caffeine? Caffeine, when you take caffeine, high doses of caffeine acutely, transiently, it can cause your blood pressure to be very high, especially if you're going to the doctor's office and you drink coffee and that have a lot of caffeine in it, your blood pressure will be high, and your doctor will be tempted to put you on blood pressure medication. So if you go to the doctor's office, do not drink a lot of caffeine. It's going to cause your blood pressure to be high. It's a transient process. But if you take caffeine every day, guess what? You are having an accumulative effect. So sooner or later, you start having blood pressure problem because it will constantly cause your blood pressure to be very high. The other one that you want to be very careful, most people who take a lot of herbal supplement like Arnica, Arnica, or ephedra in most weight loss preparations, ephedra or ginseng. People take ginseng. These are all herbal supplements, or any supplement that contains licorice. These can actually cause your blood pressure to be very high. So if you're taking some of these supplements and all of a sudden you are seeing blood pressure being very high, be careful, it's because of these. Now, I'll give you a whole list of things that can cause your blood pressure to be very high. I'll leave the list below this video so you can go through them. And if you're experiencing high blood pressure and you're on any of these, discuss with your physician for alternatives so that you will not deal with this silent disease. Now, I hope this information has been very helpful to you today, and I want you to share with your friends if they are experiencing any problem with their blood pressure and they don't know why. And also give me a like, and also leave me a comment how this information will be helpful to you. Now, remember, these days you are your own doctor, so you have to monitor the things you take for your health. Until then, Dr. Moses, I'll see you on the next video.